Hi, this is Dr. Dean Jabs. Today let's talk a little bit about facial rejuvenation. This is often indicated in men and women anytime after the age of, say, 45 on up. The typical things that we see that people complain about are that their neck looks fuller, they have extra skin, they have bands in the neck, they have jowls that are hanging down, and everything on their face looks as if it's sort of sliding down. This is caused in women typically after menopause, when they have hormonal changes that lead to a loss of soft tissue, a decreased skin elasticity, and recently it's been shown actually to the entire bony structure of the face shrinking. So we want to treat this in a way that gives people a natural look that doesn't look like they've been done. And to do this, what we first want to do is we want to address treatment at each one of these places. Now, in some people, we can do neck tightening and removal of the fat with just liposuction, and then skin tightening with something called J-plasma or Renuvion. This is a new technology that we're using more and more when we don't think a facelift is indicated. Now, sometimes you hear people say, "Oh, I don't need a full facelift, I just need a mini facelift or an S-lift," as we call it. And what that means is we're not carrying the incisions up above the eye, and we are not carrying the incisions behind the ear. There's a small incision here. The incision then goes in front of this portion called the tragus of the ear and around the back and then into the hairline. When we do this kind of a lift, the first thing we do is we liposuction the neck. We'll then tighten the bands under here with a couple of stitches. Following that, we'll elevate some skin flaps. We'll take and tighten the deeper structures, something you'll read about called the SMAS, or the submuscular aponeurotic system, SMAS. We actually tighten that with permanent sutures from in a line parallel with their nasolabial folds all the way from the cheek down to the jaw and laterally. And what this does is this tightens the deeper structures this way. It also takes the tension off the skin so that when the skin is tightened, it doesn't look pulled. This is something that we do all the time here in the office. It does not require general anesthesia. It takes around 3 hours to perform, and you're able to go home right afterwards. The anesthetic that we use is that we make you very sleepy at the time we make this numb, and then the numbing agent lasts from 6 to 12 hours. You can't drive yourself home, but you'll feel like yourself the next day. The next day the bandages come off, you jump in the shower, all the sutures dissolve except for the one at the top of the ear, and we take that out at 10 to 14 days. The other thing to consider when you're doing facial rejuvenation are the other structures. And typically what we see is that people need work on their upper eyelids or especially on the lower eyelids. And that's another topic, but we often do this with facial rejuvenation. If you have any questions, please feel free to contact the office at 301-493-4334 or visit us on the web at www.cosmeticplastics.com.